I'm Rosie from Total Chiropractic and welcome to the Friday Tea Break, and this week, yay, I have tea. Right, so the choices this week were orthotics or pelvic pain and back pain in pregnancy, and the winner was pelvic pain and back pain in pregnancy, so that's what I'm going to talk about today. So I guess the first thing to think about is when you're pregnant, it is common to have back pain, but it is not normal. So you might often be told, oh, it's okay to have back pain's normal, it's part of being pregnant, and that's not really true. The odd ache and pain is one thing, but if you're having consistent pain in your back or in your pelvis, then that's another, and you should have it looked at. Obviously you can speak to your midwife or your GP about it, but if it's something like pelvic girdle pain or what used to be called SPD, then it's something that manual therapy is really well placed to help. So there's kind of two main types of back pain that I see when people are pregnant. So there's kind of what I would call pregnancy related pelvic pain. So that is when you have back pain because you're pregnant and there's some pressure in the low back. It doesn't tend to come around to the front of the pelvis, it tends to sit mostly in the back and just aches when you sit and move around and change position. And then there's what's called pelvic girdle pain, which used to be called SPD or symphysis pubis dysfunction. And that is when you have pain more in the, as well as in the back of your pelvis, also in the front of the pelvis, right at the very front. And that can be a really sharp shooting pain, almost like you're being jabbed with a knitting needle. It's incredibly uncomfortable. And it can really affect you for walking, climbing stairs, pushing buggies, pushing trolleys, turning over in bed, things like that. Now, both of those react well to manual therapy, so whether that's osteopath, physio, or a chiropractor like myself, it's important to have someone who's going to put their hands on you and treat your body. All of these treatments tend to be very safe in pregnancy. Obviously, your therapist, whoever's treating you, will examine you and take a history to make sure that you're safe, and generally, most manual therapists have a toolbox of treatment, so we can do many different things. If we think that perhaps you're not suited to one, we can try a different technique. So how can you help yourself if you have these things? So firstly, the most comfortable position for your pelvis is with your knees hips distance apart. So it's important to try and maintain that position as much as you can. So that means do not sit with your legs crossed, either at the knee or the ankle, and don't sit with your legs sort of scrunched up underneath you on the sofa in the evenings. Those positions are really irritating for the pelvis, and it may have been in your pre-pregnancy state that your pelvis could cope with it, but at the moment it can't. So you need to sit with your legs out in front of you. Ideally, I wish you to find incredibly comfortable on some sort of footrest. And you need to have your back supported, so you're not slouched back in the sofa. You might have cushions behind you. Ideally, when you're sitting with your hips, your hips higher than your knees, so you have a kind of slight slant in your pelvis. That puts your low back in a really comfy position, and that's the position that you kind of want to be in. And I think that that's quite a problematic position for most of us to get to, because as a woman, generally, as soon as you sit down, you cross your legs, and getting out of that habit is really hard work, but it's worth doing because it will really help your back stop being irritated by that cross-legged position. The other thing is to think about your sleeping position. So there's numerous kind of pregnancy cushions for sleeping on the market. I always think the best one is the kind of very long sausage-shaped one with a bit round the back as well, so that it goes under your bump, between your legs, which helps keep your knees hips distance apart, supports your bump, and then some of them have a bit that go behind the back as well, so it kind of supports your low back in bed. So that really helps as well. So that's one way, is mainly changing your sitting position and your sleeping position. The other thing to think about is how you're doing things throughout the day. So you need to do whatever you can to minimise the stress on your low back. So things that stress the low back generally are kind of lifting, carrying, twisting. Now, if you already have one or more child, you'll know that when you're pregnant at the second or third time, it's really hard because you can't, things that annoy it, lifting, twisting, carrying, are usually all the things that go along with young children. So as much as you can, try and avoid that. Now, I know that's almost impossible, but try and make children climb onto your lap for cuddles. Try and get them to sit onto or move up onto steps or something, so that you don't have to bend down as far to do shoelaces up and things like that. Another thing is to look at how you're doing stuff around the house. So for instance, I found that hanging the washing out really irritated my back because I was bending down to get to the washing and then peg it out. And just putting the washing basket on a chair meant that I didn't have to bend. So that really helped. So lots of little life-saving things like that can really help stop putting the pressure on your back. And ask for help. If you're really struggling with your back, ask for help from family members, from friends. You know, say, when people say, what can I do to help? Then say, can you put the washing away? Can you unload the dishwasher? Because it's really hard to ask for help, but sometimes that's what you need to do. Finally, then get some treatment for it. as I said, pregnancy-related pelvic pain and pelvic girdle pain generally I find respond well to treatment. And if you can get it started earlier, as soon as the back pain starts, then that can help quite a lot. So pop in to see a chiropractor, physio and osteopath. They can all help treat this kind of problem. If you're looking for someone particularly with special interest or experience of treating this, then you can look on the Pelvic Partnership website. The Pelvic Partnership is a brilliant resource for any information about pelvic girdle pain, and they have a list of practitioners that are that they've had good recommendations from other women who've been treated for pelvic girdle pain. So then that points you in one direction. Or another way is just to find someone and phone up and speak to them, because most therapists will speak to you for 5 minutes on the phone. They might not be able to give you any definitive diagnosis or advice because they won't have looked at you, but they'll be able to speak to you to see if they can help you, and you'll get a feel as whether you think they can help you. So that's the best thing to do, is to get someone to have a look at you and do some treatment on you. Sort of pelvic pain tends to start often around kind of week 16 to 20, often as you get more pregnant and you start leaning backwards because the bump gets bigger. That tends to be when the pressure on the joints in the low back starts to get more, and then that starts to give you pain around the back and the front. So what can manual therapists do to help you? So chiropractors like myself and physios and osteos, what we'll do is we'll assess which joints are moving too well and too little. So generally you have the pelvis is a ring structure. So you've got the symphysis pubis joint at the front and the two sacroiliac joints at the back. And those joints should all work together in a lovely way so that the pelvis works well. When you are pregnant and there's more pressure on the pelvis, often due to the change in your posture as you get more pregnant, what that happens then is the pressure starts to be distributed unevenly. And often what I find is although the pain can be very much at the front of the pelvis in that symphysis pubis joint, it's often one of the joints at the back, the sacroiliac joints, that's not moving as well, that's putting more pressure on the front. That would then tighten muscles in the low back and the bottom, can then cause quite a lot of problems. So what, as a chiropractor, I would do would be working to calm the muscles down and get the joints moving better, and then give you exercises and advice to try and avoid it getting worse. Sometimes when you're heavily pregnant or if it's very bad, then we're just trying to hold you in the position you are now or get you a little bit better. The trouble is during pregnancy, obviously you want the bump to get bigger so that the baby's growing nice and healthy. But as you're trying to treat your back, obviously we're kind of working against the bump getting bigger and putting more pressure and weight at the front of your body, which can put more pressure at the back of your body. Right, I hope that's been useful for you. So your main take-homes are that if you're having problems, get someone to look at it. Try and keep your knees hips distance apart, and do not cross your legs or tuck them underneath you, and sleep with a pregnancy cushion, and get people to help. Help you around the house, help you with the kids. Don't be afraid to ask for help. People often want to help, they just don't know what to do. They need you to tell them. If you want to know more information, then there's a brilliant podcast that myself and Sarah Fishburne from the Pelvic Partnership did, which goes into lots of detail about pelvic girdle pain, so we'll pop that in the link. And also I've written a few blogs about this. I had this condition myself, the pelvic girdle pain, during both my pregnancies, so I know how debilitating and annoying and frustrating it can be. But I also know by getting someone to treat you, which I did, so I couldn't treat myself, but I always had chiropractic treatment, that can help you and means that you can function relatively normal. And also the other thing to remember, which is really important, is that most of this goes away once you've had your baby. Not all of it, but most of it. But it doesn't mean we can't make your life a bit more comfortable, a bit more bearable whilst you're pregnant. So if you are pregnant, if you've got any questions about this, then you can leave comments below, or you can get in touch with me, and you could book a chiro chat if you wanted, which is a free 20-minute appointment. You can come and talk to me about your problem. There's no treatment, but I'll give you an idea whether I can help you or not. And if I can't, I'll refer you to someone that can. So I hope you found that hopeful. I hope you found that useful. And hopeful if you're in a bad position with your pelvic pain. There'll be a new Friday Tea Break choice on Monday, and I hope you found that good. Take care. Bye-bye.